While the president speaks, the battle over health care in Congress rages on.
Let's talk about it with Republican Representative Mike Pence. He is of Indiana. Congressman, what changed? We know that the Democrats came in with this tax proposal. That dropped like a lead balloon. Was that really the changing moment on the debate here?
Well, I think the changing moment was when they raised the curtain on this government takeover of health care last week that's to be paid for with nearly $1 trillion in tax increases. I mean, look, we've lost 2 million jobs in this economy since they passed the so-called stimulus bill. We just passed a massive national energy tax in the form of the cap and trade, and now comes the administration and House Democrats with a bill that would pile more tax increases on Americans to create a massive new government insurance option that will result in tens of millions of Americans losing their health insurance. And I think the problem here is no one moment. I think it's the American people are taking a hard look at this bill and they're saying we can do better.
You know, sir, we have had a housing and a credit market collapse. That's rare. It is very rare to see that in a century of stock market trading. Is the president playing politics by choosing to bring up Senator DeMint's comment, but not still citing the CBO report, which really was a game changer about what it really costs the U.S. government? It would cost a lot more, the CBO is saying, than what the White House is saying. What do you make of that?
Well, look, you know, I respect the President of the United States, but I don't respect these tactics. You know, here the administration is, the facts and the policy are not going over well with the American people, so suddenly they're just going to accuse us of politics as usual in Washington, D.C. Look, their problem is not with Republicans in the House and Senate. Their problem is the American people don't want a government takeover of our health care economy. They don't want nearly $1 trillion in tax increases, and they know that if you introduce a government-run insurance option, that they're very likely going to lose their current health insurance, and they just might lose their job. This president ought to you know, take a half step back, take a breath, and give Congress a real opportunity this fall to come together in a bipartisan way with some modest reforms that will really invigorate the fundamental foundations of our private
health insurance system. All right, well, let's ask you, Congressman, to be specific. What do Americans want, and what are Republicans going to propose?
Yeah, look, well, Republicans have been proposing a broad range of ideas. One of them is association health plans. Why on earth can't Americans buy their health insurance across state lines? Why can't employers, say restaurant employers, pool all their employees on a national basis and come up with an affordable health insurance product? We could bring about that reform tomorrow and introduce a whole new range of insurance options for small businesses and give millions of Americans who are not offered health insurance in their employer today that option. Also, medical malpractice liability. You know, I was sitting down with some docs back in Anderson, Indiana about a week ago, and every single one of them said to me that the runaway cost of medical liability insurance and medical liability damage awards has resulted in the escalation of costs in our healthcare system. And yet last week, in both committees, Democrats consistently opposed any effort to promote association health plans and every effort to bring about the kind of medical malpractice liability reform that it really contained costs.
All right,
there are ideas out there we can pass, but this government takeover of health insurance with $1 trillion of tax increases is going over like a lead balloon with the American people.
All right, sir, you mentioned the Democratic opposition on those two counts. You know, the president also said that, you know, this country has always done what is the hard thing to do because they know what is the right thing to do. Are you saying that the Democratic plan is just the easy way out of just more taxes and soaking the rich? Is that what you're saying?
Yeah, well, look, I think the Democrat health care plan is a disaster for patients, for jobs, for taxpayers present and future, and for Americans who cherish traditional values. So let's set aside that disaster. You know, and as to the hard thing, you know, I love this president's capacity for flourishing rhetoric, but really there's nothing hard about a Democrat majority in the House and a Democrat majority in the Senate sending tax increases and more government to a Democrat president at the White House. The hard thing to do would be to compromise. The hard thing to do would be to find ways to fundamentally strengthen the private health insurance foundations of our healthcare economy in ways that will benefit Americans and ultimately result in a higher quality and lower cost of healthcare.
Congressman, we got to leave, but Senator DeMint did fight back after he was singled out, or his statements were singled out by the president, saying, among other things, that the president is not issuing this mid-session budget review, that the president is withholding figures. Do you have anything to say on that?
Well, that's right. The administration's holding back the mid-year CBO analysis because, as most experts expect, the numbers are even going to be worse than they were last time around. Look, unemployment's worse, the deficits are worse. The American people know that a government takeover of health insurance financed with $1 trillion of tax increases in the worst economy in 25 years is a profoundly bad idea. Republicans are going to consistently and persistently oppose it, and with the American people behind us, we're going to win this fight.
All right, sir, thank you so much for joining us this afternoon. We really appreciate it. Good luck to you.
Thank you.
Congressman Mike Pence from Indiana.